Yeah, hello everyone. Welcome to Nurse's Lecture Room Live today. Today is more or less like question and answer section. I could not actually pinpoint a particular topic to talk about today. Yes, I couldn't just think about a particular topic to talk about today. And I decided to just, okay, let me come live. And if there is any question, I'm going to take it. All right. Good evening, everyone, and welcome back to Nurse's Lecture Room. If you're coming across this channel for the first time, my name is Mercy Mary. I am a registered nurse and a registered midwife. And on this channel, we talk about health in general. Though most of our topics are specifically about sexual and reproductive health, but we talk about health in general. Hello, Agatha Eze. How are you doing? Trust you are doing great. It's nice having you on our night section today. Hi, Agatha. Agatha was my head girl in secondary school. That's the name of my head girl in secondary school, Agatha Odama. She was my head girl in secondary school and she was amazing. So we have Adioze Lambe 60. Hello, how are you doing? Welcome to Nurses Lecture Room Live. And we have James Basti Omed said, hello. Hello, James. How are you doing? Trust you are all doing great. It's nice having you all on our live today. So like Ella said, for the now, I don't know what topic to talk about. For the now, I don't know what topic to talk about. So I just came online. If there's any particular topic you would like us to discuss, drop on the comment section. If there is any particular topic you would like us to discuss, kindly drop in the comment section. If there's something, if you have any question, kindly let me know too. I will be willing and ready to take the questions. But while waiting for the inspiration to come up for the topic to talk about today, I am here to take your questions. So when I get the particular topic to talk about, definitely I'm going to pop the title. I'm going to change the title and talk about what I want to talk about. Hello. What topic do you want us to talk about? I'm still thinking. When I finally get the topic, I'm going to come back again. But now it's more or less like a ticking section. Hello, Mulum H. How are you doing? Trust you're doing great. Hello, Lambe. I'm really glad to join today's section. Thank you for joining today's section. Today's section is more or less, I'm still thinking. Normally, we start our live about 10 o'clock. I'm still thinking if any inspiration is going to come for a particular topic for us to talk about. So to get a particular topic to talk about, I think the best thing for me to do is to go to my comment sections and see if there is any topic that that my audience want me to talk about. So if you're just joining us for the first time, my name is Mercy Mary, and on this channel we talk about health. James started saying, James Basiomet said, I recently started sensing serious chest pain, like peppery and pain. You said chest pain, like peppery and pain underneath my foot. Okay, do you have chest pain alongside with pain underneath your foot? Those are like two different symptoms. What I would advise you to do personally, if you're having serious chest pain, I will advise you speak to the doctor as soon as possible. If you're having serious chest pain, my advice for you, James, is to speak to your doctor as soon as possible for proper assessment and diagnosis to be made. That is my personal advice. trying to check for a particular topic on the comment section for us to discuss. Okay, James said, this is my first time. Thank you very much for joining, James. We have Adjo Zelambi said, please, can ketones be cured? Yes, ketones can be cured. You get, particularly if ketones are being associated to diabetes, like diabetic ketoacidosis. So with proper adequate medical attention, it can be sorted out. So when your doctor says you have some ketones, I think you should you should meet him and have a conversation with him proper on the next line of action to take. But ketones can be cured, especially when it's related to diabetic ketoacidosis. That's from diabetics. I'm just trying to open my YouTube channel on my computer to see if there is any particular topic people would like me to talk about. So while waiting, if you have any questions, kindly let me know in the comment section. All right. Do we have any questions? Today's more or less like the question and answer section. All right, you're welcome, James. Hello, Izeri, Alfred. How are you doing? Trust you are doing great. Do you have any questions for us? Do you have any question for us? If there's a particular topic you would like us to discuss, just let us know in the comment section. All right, I think I'm getting some ideas. By 10 proper, our life is going to start. This is just like checking. Hello, how are we all doing? Welcome to Nurses Lecture Room Live. From 10 p.m., we're going to be talking about infertility, the different types of infertility and what can be done about it. So from 10 p.m., we're going to talk about infertility. So I'm just using this to keep myself busy while trying to prepare for the live starting by 10 p.m. But if you have any questions, feel free to ask in the comment section. Hello everyone and welcome to Nurses Lecture Room Live. By 10 p.m. today, we'll be talking about the various types of infertility. Yeah, the types of infertility, what infertility is all about. By 10 p.m., that's what we're going to be discussing on the live section today. So by 10 p.m., we're going to be talking about everything you need to know about infertility, the causes of infertility. So we're going to be analyzing them today by 10 p.m. So that should be in the next 10 minutes. In the next 10 minutes, you can go get some water, get your pen, get your paper, and come back by 10 p.m. where we're going to be talking about the different types of infertility, from primary infertility to secondary infertility, male infertility, female infertility. We're going to be discussing that by 10 p.m. So that is like 10 minutes from now. So feel free to go get a coffee, get a cup of tea, and wait. Hello everyone, for those that are just joining, my name is Mercy Mary. I am a registered nurse midwife in Nigeria, but currently practicing as a registered adult nurse in the UK. So by 10 p.m., we're going to be talking about infertility. We are going to be talking about the different types of infertility, primary, secondary, may causes of infertility, and we're still going to be talking about unexplained infertility. So by 10 p.m., that is like 8 minutes from now. So feel free to go back, get a coffee, get a cup of coffee, get a cup of tea, get some water, get your pen or your paper just to document and learn new things. Remember, in every of our live sections, there is always something new to learn. If you have not been following us on our various live series, just go on our YouTube channel and check our lives. You'll see that we've done a lot of interesting and engaging content. But today we're going to be dealing with infertility. We're going to be talking in details from 10 p.m. about infertility. So by 21:59, I'm going to be ending this live and renaming the live again. So you know, all right? So feel free to go get everything you need, get everything sorted out, and come back by 10 p.m. So you have like 7 minutes to get things sorted out. Okay, so we have Saba Joseph. Saba Joseph Ali said, what are the causes of miscarriage? I think we've made a video on the various causes of miscarriage, and one of it is actually chromosomal abnormalities. I think sometimes the cause of miscarriage is not what you can control. Like the names talked about, chromosomal abnormality. This is one of the major cause of early miscarriages. It accounts for about half of all the cases of miscarriages. It's the chromosomes. They not your fault. So it's chromosomal abnormalities in a developing baby, in a developing embryo. And sometimes some miscarriages can be due to maternal conditions, such as uncontrolled diabetes, thyroid problem, like thyroid gland. There's the thyroid gland is here. So if there's a thyroid problem, that can cause miscarriages. Uterine abnormalities like fibroid can cause miscarriages. Blood clotting disorders can cause miscarriages. Infection can cause miscarriages. So all these things, but more than half of the miscarriages are usually caused by chromosomal abnormalities. And also there are some studies that actually talked about our lifestyle. So lifestyle that includes smoking, alcohol, caffeine intake can actually cause some miscarriages. I don't know if that helps, Saba. I don't know if that helps, Saba. But most of them are as a result of chromosomal abnormalities. Saba, let me know if it helps, because I will be ending this video now to actually start again to talk about fertility. So we're going to be renaming the video again. Where we'll talk about infertility. And I'm going to be explaining what it actually takes as a woman to get pregnant. What is involved in your body for you to get pregnant. Okay, so most people just feel it's just sex, but getting pregnant is more than just sex. If anything goes wrong with any of these things I'm going to be explaining in the video today, pregnancy cannot take place. There's going to be a problem conceiving. There's going to be infertility. So I'm going to be explaining it in our life section. All right. So I'm going to end the life, rename the life as infertility. So don't go anywhere. The life is going to be starting in 2 minutes time, and we're going to be talking about everything infertility. So stay tuned